So I'm Sig Berven, and I've been a spine surgeon at UCSF for 25 years. My practice primarily involves complex deformity, primarily adult complex deformity, some pediatric work, but it really involves a broad spectrum that includes everything from degenerative pathology to tumors, but primarily I'm doing complex adult deformity work. So my experience with Catalyst as a bone graft substitute has been relatively recent, but very positive. And specifically, I'm using synthetic biologics as an extender to autograft. Most commonly, I'm using this in my inner body fusions, um, commonly with T-lifts, as well as with some direct laterals, as well as A-lifts. And I've also had some experience using this in the posterolateral space, especially in post-laminectomy and revision cases. I find that in the operating room, the handling properties are excellent compared to some other synthetics I've used. It really stays in the field well. It molds to the space that I'm working in. And in terms of performance, most importantly, I really don't have personally any long-term outcome, but I've been really impressed with what's been available so far in the registry in terms of long-term outcome. I've seen some really good evidence of early bone formation, which I haven't seen in other synthetics, and I'm really looking forward to getting some of my own long-term results. When I'm choosing a biologic for a case, there's a lot of things I consider. There's a lot of variation in what we do practice to practice, even between providers, a lot of variation in what we do. In general, when I think about a biologic, I think about what the mechanical needs are, and I think about what the level of performance is. And then I think also importantly, considerations of cost and complications are a big part of the negative parts of a biologic. So number one, with regard to performance, a lot of times with the biologic, we don't have head-to-head comparisons. I think that's one of the greatest deficiencies of an evidence-based approach to developing or to an evidence-based approach to using biologics. In the absence of comparative effectiveness, oftentimes we're going on less robust data. When we think about the hierarchy of credibility, for most biologics, we really don't have level one evidence. We're going off of more clinical trials, sometimes comparative studies, but that's really what's missing in many instances is comparative evidence. So the most important thing to me is efficacy, and sometimes that's derived from preclinical evidence. So the vast majority of biologics, I've at least got evidence of how effective is this in a posterolateral rabbit model, or how effective is this in some other preclinical study. That's where I can really get my head-to-head comparison. So if I'm going to use a synthetic, then I want to know that it performs as well or better than other synthetics in a posterolateral fusion model. And then I'm going to want the best level of evidence available from a human clinical study. And those are the two things I consider. The other considerations that I think about with regard to choosing a bone graft material, of course, are the location. So specifically where I tend to use synthetics is in my inner body space for a T-lift. I also sometimes use synthetics to augment posterolateral fusion, particularly in degenerative pathology. What I find useful about the Catalyst is that the handling properties are such that it stays together, it doesn't wash out from the bed. So using this ipsilateral to my T-lift, for example, so ipsilateral to my facetectomy, it's well contained there. It doesn't fall into my facetectomy window. So I find that to that end, it being structurally integrated is really useful. I've had the opportunity to speak with my colleagues and peers across the country about a lot of different bone graft materials. And I've got terrific enthusiasm for different materials for different clinical conditions. Again, the biology of the individual case, as well as mechanical properties, are some of the things that go into consideration. I think Catalyst is something that, for me, has got the best level of evidence of a synthetic on the market, and it's really quite comparable to even much more expensive products that are on the market now.